Welcome to Life Sketches, a Chico, California Steak podcast. I'm Melanie McLaughlin, and today we have Mike Wiltermood visiting with us. Thank you so much for taking time out of your schedule to come visit with us. All I know is that you are CEO at Enloe, which sounds super important, but I don't know what a CEO does or how much time would be involved in a responsibility like that. Would you share a little bit about your job and what it entails?
Sure. Thanks, Millie. It's a pleasure to be here. Being the CEO of a hospital is not much different than being the president or CEO of any other business. We have a budget of about $850 million, 4,000 employees, and it's our job to manage the budget and make sure that the people that provide health care, our doctors and nurses and other professionals, have the support that they need to do a good job.
And about how many hours a week do you spend at work?
Well, it varies. In some respects, we're never off the clock. It 50, 60 hours a week. Sometimes when we have really difficult challenges that we have to work through, particularly when we have disasters such as the Camp Fire or the pandemic, the hours kind of increase. But, we've got good staff. I've got a lot of good support and people that can take my place if I need a break. So it's not too bad.
That's really great. And you've been CEO since 2009.
Yes.
Is that correct?
Yeah.
What are some highlights that's about, 15 years. Any highlights that come to mind as you think of your time there?
Well, yeah, hospitals are very complex organizations, and there's always a lot happening. There's a lot to worry about and a lot to be proud about. I think over the years, some of the things that we're very proud about has been our disaster response, our ability to take care of the community during the Camp Fire, during the Oroville Dam evacuation, to take care of people during COVID. So those circumstances were very stressful for a lot of our staff, and just being associated with those folks and watching how they responded was a real source of pride for me to be affiliated with those folks. I think the expansion of the hospital in 2013 with the 190,000 square foot Magnolia Tower was kind of a big deal. But every day we try to get better. I think the first time we started winning awards from outside rating agencies was kind of a big thrill for us. There's an organization called Health Grades that's rated us in the top 5% of community hospitals across the country for the last 3 years in a row. But at the same time, you get those awards, you realize that you can do better and kind of worry about not getting them. So while it's a source of pride, it's also something that we worry about, But there's almost too many things to list in an organization as big as ours.
Mm-hmm. That would be a pretty high bar to try to meet every year, right? To continually get that recognition.
Right.
But that's great. 3 years in a row that you've had that. Mm-hmm. what got you started in hospital administration in the first place?
Well, that's a really good question. I'm a member of the Church of Jesus Christ of Latter-day Saints. I joined the church when I was a junior in high school, and I served a mission in Monterrey, Mexico, which at the time was about the size of the northeast quarter of this country of Mexico. It was very large. It was an 18-hour bus ride to go from north to south, and I did that twice. But working with people that had such modest circumstances, I think made me want to give back somehow. And I was fortunate enough to go to BYU and get introduced to some professors that were starting a healthcare program there. And, the idea of being in business and being able to, to be in a really interesting profession and also have an opportunity to provide, to give back and, in a field with that sense of mission. I've kind of learned as I've gotten older that we can have a mission and a purpose in almost any legitimate work that we do. But at the time, healthcare had its appeal, and I went ahead and applied for their master's program and was accepted, and I've been in the profession ever since.
And you've mentioned how rewarding it is to work with, you've called them supportive staff and health caregivers, but what is specifically rewarding about being a hospital CEO?
Well, there's a lot of things. I mean, in my role, I get to see people develop in their field, and it's really fulfilling to be able to be part of their journey in their profession. And we've, as I mentioned, we've got 4,000 employees of all stripes, engineers and nurses and techs and environmental service workers and food service workers. And watching people grow and develop is really a thrill for me. Being able to support them in their roles kind of helps me feel a sense of purpose, and knowing that we're here for the community and to try and raise the health status of the community that we serve is important as well. At the same time, a position like CEO of an organization as large as Enloe Health has some responsibilities, and it gives us an opportunity to get to know other people who have missions in the community service organizations and people that work in government, and so it gives us, I think, an opportunity that maybe some people don't readily have to participate in other great projects to make our community a better place to live.
And what would an example of one of those projects be?
Well, as an example, we have a lot of great donors that contribute to the hospital as a nonprofit organization and help us, with our buildings and our equipment purchases. Many of these people have projects themselves, and we're kind of, we get invited a lot to participate. It's not just me; it's my wife Kelly. Mm-hmm. And we've had an opportunity to do volunteer work for and serve on boards. The North State Symphony, or something maybe boards with Chico State, service organizations like Rotary, and of course there's all kinds of opportunities in the church. But we've tried to take advantage of those as much as we can, and I think those relationships that we build help our community, make our community a better place. And but it's very rewarding and fulfilling for us to be able to participate.
You may want to choose just one instance, but I'm thinking of the pandemic and the campfire, and you mentioned Orville Dam, any of these crises that our community faces. What approach do you take to even begin to address the needs that our community needs?
Well, periodically we work with Butte County and other healthcare organizations in the area and develop what we call a community needs assessment, and those assessments help us prioritize where we put our resources. Some cases, some things there that our community needs only a hospital like ours can provide, and there's other things where we need to partner. Some of the looming concerns that we have, I think we're all aware of: homelessness and mental illness and addiction, and those are things that are chronic that we need to partner and work together and collaboratively with to try and resolve. There's there's other issues. Clearly, as a trauma center, the only trauma center for 6 counties, we have to make sure that we always have the capability of responding to trauma, car accidents, or things that can be even worse. And so that's our wheelhouse, and those are things that we have to stay on top of continually if we're going to do a good job. Most recently, we did a study on general health status, and I guess it wasn't much of a surprise, but the surprise for us was to find out how much more cases of cancer we have in our area. It's when we compare ourselves to the rest of the state, we're about 30% above the average. And of course, unfortunately, that brings with it a higher mortality rate due to cancer. And so we're seeing that cancer is being diagnosed more frequently and later in many cases. And so one of our
as in later stages of cancer.
Yeah, exactly. And so one of our big projects is to improve the response that we have for cancer, bring a broader array of treatments, collaborate with academic medical centers like Stanford, UC Davis, UC San Francisco, and get the best and brightest here so that we can make a dent in this very, very awful condition.
Mm-hmm. And you're bringing up something that it's detrimental to families, like to deal with cancer, and there's an array of cancers, right? It's all over the place. But as an administrator, from my chair, it feels overwhelming to be in your chair, to have to be aware of some type of medical knowledge and financial knowledge, and there's all kinds of pieces that go into place for treating cancer or bringing in specialists or taking care of that. What kinds of specific knowledge have you gained over your time of being CEO?
Well, I'm not a clinician by any stretch, but after 40 years, I guess by osmosis, I kind of learned a few things. But the most important role that I have, as I mentioned, is to support the experts. And we've got a great medical staff. We've got very well-trained clinicians. And, I think my job in many respects is to just stay out of their way and give them the tools that they need to do a good job. The decision to allocate resource is a team decision. We have a nonprofit board of trustees who volunteer their time, hours and hours, to help us stay on the right path. And we collaborate strongly with our medical staff and our clinical professionals to make sure that our priorities are in the right place. And so it's not a situation where the administrator has to know all that stuff, but we just have to. I guess my role more than anything else is to keep people communicating and kind of break down any barriers to the challenges, resolving the challenges that we have.
So working more with personalities and people, individuals, than being required to know specialties.
Yeah, it's more the organizational skills, I think.
Mm-hmm. What are some things during your time as CEO that you're especially proud of?
Well, I've been in the profession for 40 years, and I think that by itself is probably something to be proud of. Sometimes these jobs can get a little political, which is unfortunate. But learning and growing and continuing to strive to be better, I think, is something every professional has a desire to do, and just being able to navigate the roles and responsibilities and try to be a good person and keep my priorities straight, I think is something I'm proud about. I believe that our family has worked out how do you keep your priority with your family, your relationships, and still do a good job as a professional, I think is something we all struggle with a little bit. And, I'd like to think that we did a pretty good job there as a family.
That's a pretty great thing to be able to say, because I agree with you. I think everybody struggles with that, no matter what their profession is. So that's really great. How much do you interact with doctors, nurses specifically?
Well, every day. We have designated leaders amongst the medical staff and great director of nursing services over at Enloe Health, Donna Larson, and nurses of all kinds of capabilities in all different positions. And so, every day we talk about how can we make things better. Sometimes there's, little mini fires that we have to put out where maybe a certain situation doesn't quite fit our policies and procedures. Those are things that are quickly resolved. But, it always seems like there's something, whether it's something that we failed at that we've got to fix, or something that we have to deal with. But, it's really great to be able to interact with so many talented and educated people who really want to do the right thing. But that's a lot of my job, and it's really one of my favorite aspects of the job.
Is dealing with is all the individuals.
Well, is learning from them, being able to collaborate with them, being able to work through problems collectively. It's a great feeling when we're successful.
Mm-hmm. Do you have like a typical day schedule? Are there 2 days that are the same in your work?
Oh, yeah, I guess there's a bit of a routine. We have our regular meetings with the board, with physician leadership. We have committees that are tasked with certain goals and objectives that, we have a lot of meetings, maybe too many, some people would say. I think the world for me changed quite a bit when I got my first computer on my desk and the emails started coming in. So managing correspondence is a big deal. There's authorizations for payment and contracts to sign and pro formas to develop and things like that. And I think that's why I say that my favorite part of the job is when I'm able to deal with actual people instead of a piece of paper or a computer screen.
Mm-hmm. Yeah, that's much more rewarding.
Yeah.
What has surprised you in your 40 years as far as healthcare improvements, progressions?
Well, I think what has surprised me from when I originally got into healthcare is, we expected some monumental changes in the way we approached healthcare. Being an administrator, I think a lot of what we learned in school was, about finance, and the cost of healthcare continuing to rise was just seen as unsustainable. It's just really interesting because I think in the 80s, when I was in school, healthcare in the United States was about 7% of the gross national product, and that was considered unsustainable, and it's close to 20% now. It's a huge drain on society, and it's a huge part of the tax base. And yet, the fundamentals of healthcare haven't really changed all that much. I mean, we kind of keep moving the deck chairs around, but we have yet to figure out how to bring high quality care at in an affordable way to everybody. Unfortunately, we see the disparities in healthcare and the social determinants of health, the poverty that it impacts, and just the environment, how people are able to access care or not access care. And, there's a lot of suffering that goes on needlessly if we could just resolve the issues, but we just haven't figured out the magic formula yet.
So would that be a goal of yours?
Well, one of the reasons why working for an organization like Enlo is so attractive is that is its geographic isolation. If you're working in downtown Los Angeles and sharing space with 20 hospitals, it's hard to say definitively if your particular organization had a direct impact on the population because it's so interspread. At least here we have a bit of an opportunity to work in our own microcosm, our own environment, if you will. And, hopefully, we can measure whether our efforts are really having an impact, a positive impact on the community. One of the unfortunate things, I think the things that has been so difficult for us over the last few years is, I think it was about 2017, we were just thinking, we're getting to the point as an organization where we're big enough, we're diverse enough, and we have the resources to really have an impact, a positive impact on community health. And then the campfire hit. And we have been spending the last 5 years trying to replace the infrastructure that was destroyed by the fire. It's been very, very difficult to watch, to know that we can't, we're behind the curve. People have difficulty getting doctor visits, specialty visits. Our primary care network has been decimated. Some of the people we used to rely on have reached retirement age, and we haven't been able to replace them. The whole issue of the campfire, and even though it's 5 years in the rearview mirror, we're still very much suffering from the impacts. And so our goal is to rebuild that infrastructure. And if we're able to do that in the next few years, I think it will be something to be very, very proud about.
Mm-hmm. Do you have like a goal date to have that completed, completed as possible?
Yeah, so there's several elements involved. One is just simply physical space. It took us a while, but we were able to restructure our bonds, and so we were able to borrow an additional $200 million or so towards the development of infrastructure. And then we've got to fill those buildings with competent people, particularly physicians and the healthcare professionals that specialize in the areas that we need to take care of. So, it's been a long time coming, but we finally have some funding. One of the interesting things about the campfire that I'm not sure people think about very often with respect to healthcare is that, nothing that Enloe Medical Center owned or operated was damaged by the fire. The buildings that were damaged by the fire that paid insurance money or that resulted in a PG&E settlement, those monies have left the county. And so we're required, really, ethically and morally required, to rebuild that infrastructure with no help. We have gotten, none of the healthcare services that have remained, including nursing homes and the other hospitals in the county, have received aid of any type to rebuild. And so that's been the real challenge for us. Mm-hmm. And so it's one of the reasons why we weren't able to immediately start reconstruction. But we've rented space. We've put people in nooks and crannies. You think about the difficulty of going from a 200-bed hospital to a 300-bed hospital overnight. And it puts a perspective on the challenges that are ahead of us because, like I said, it's not just the hospitals. It's assisted living centers. We lost 300 nursing home beds to the fire. That's a lot. Mm-hmm. in a community our size. And so the fires had a ripple effect. The fire and then the pandemic that followed has shut a lot of doors. In the last couple of years, we've lost additional businesses, imaging centers and home health hospices and, primary care practices, pharmacies. A lot of organizations have just not been able to make it post-pandemic. And so I believe that the community is looking to the hospitals to try and fill those voids, and it hasn't been easy. But, we at least now have some money and we have a plan. And, Oroville Hospital, as you know, is completing its expansion. That's going to help a lot. And so it's just a matter of us putting our plan in place and recruiting.
So immediate goals for Enloe are just to rebuild that infrastructure to where it was before and continue going from there.
Yeah, as best we can, and hopefully make it a little better in the process.
Mm-hmm. Is there anything that you would like to share about your job, your career?
Well, our family, I think, has really benefited from the affiliation with healthcare over the years. And, as our kids were growing up, one of the ways that we stayed together as a family was to participate in service projects together. And I think there's real opportunities for families to do that. And it's great to see, I think sometimes our kids don't have that much direction. And with our children, we had four children. And, from the time they were little, passing out Kelly's homemade Christmas cookies to patients and employees on Christmas Eve or Christmas, to the other projects that they participated in. Our kids, I'm really proud to say they never balked at service. They sometimes balked at the restrictions we put on them, especially when they were teenagers. Mm-hmm. But whenever we asked them to come and help us, say, pack food baskets as the Salvation Army or go do a cleanup in the park, or they were always willing to serve. And I think that that's benefited them in their adult life as mm-hmm. well.
Mm-hmm. Really great opportunities as kids to learn to look out for others.
Yeah. Between me working at the hospital and our affiliation with healthcare and the church, I think they had plenty of opportunities mm-hmm. to provide service.
Mm-hmm. That's pretty rewarding. So in regards to the cancer cases that you say have been increasing, do you notice specific types of cancer that are coming about more often?
Well, yeah, I mean the encouraging and discouraging thing is that these cancers are not esoteric cancers. It's the four most common cancers that we have: lung cancer, colon cancer, prostate cancer, those kinds of cancers. And these are cancers that we're fully capable of taking care of if we can get an early enough diagnosis. So there's others that I haven't mentioned that are also well managed, and there's some great new therapies out there that are enabling us to treat cancers that were previously untreatable. So we're very hopeful that we'll be able to make a dent in the rates of cancer that we have, and especially the mortality.
What long-term goals do you see for Enloe in the next, 20, 30 years?
Well, one of the things we have to look at with respect to growth is just the structural elements of buildings and program development, things like that. The money that we've borrowed doesn't really get paid off for quite a while. And so the next iteration for us will probably not be for 20 years where we're able to sink a whole lot of money into infrastructure and development. But there's other ways that we can expand. And as I mentioned, our big goal over the next 5 to 10 years is to create excess capacity in our clinics and in our outpatient services so people can get the primary care that they need to stay healthy. And that requires us to grow our diagnostic capability. Right now, we Open Systems Imaging, which is a large imaging service here in town, went out of business, and overnight we're overwhelmed with referrals, and our equipment's being overused, and then it starts to break, and so we need to build new imaging centers. We need to expand our lab capability. We need to bring more physicians and healthcare professionals into town. And, the buildings are important, but without the people, they're no use to the community that we serve. And so I see that as being the big focus. And then for our organization, making sure that we have a consistent culture that works to the benefit, that keeps the community first in all we do, is going to be a challenge, because the bigger we get, the more we grow, the more spread out our campuses are, the harder it is to maintain that continual positive culture. And frankly, after the campfire, we were desperate to grow. And so we're kind of finding that now we've got to kind of take a step back and, recommit ourselves to our mission and the vision that we have for the organization. And so those are all challenges that we'll be dealing with in the coming years.
It sounds like you have, at times, an overwhelming responsibility, and also at times just a very rewarding career.
Well, yeah, I found it very rewarding. It's my job not to be overwhelmed, and like I said, with all the great professionals that we have in our community, it's hard to not be positive about the future. And so it's been great working.
Well, thank you very much for taking some time out of your day to come visit with us. We appreciate it.
Thank you. I enjoyed it.